This is Dr. Nagaraj Kikeri from North Texas Team Care Surgery Center. And March is Colon Cancer Awareness Month. Colon Cancer Awareness Month is a big deal because this is one of the preventable cancers. We would like to welcome Dr. Farbod Masrour. Dr. Masrour went to University of Texas in Dallas, and he went to medical school in Toro University in Nevada. And he got trained in internal medicine and did his fellowship with gastroenterology at Medical City in Fort Worth and also in JPS Fort Worth. He is kind enough to join us today to answer some of our questions regarding colonoscopy. Our viewers have already sent me a bunch of questions. So thank you. Welcome, Dr. Masrour.
Thank you for having me.
One of the biggest questions I get asked from my patients is that, hey, I want to have colonoscopy done, but I'm afraid. Is it painful? Somebody is going to put something in my rear end, and that is their most feared apprehension. Is colonoscopy painful?
Colonoscopy itself is not painful. Patients may have some discomfort at the end of the procedure. After they wake up, they may have some bloating, but no, it's not painful. And actually, from an anesthesia standpoint, since you're an anesthesiologist, you can maybe address the issue of sedation and how we can make this process more comfortable for the patient.
And you have asked a very relevant question. Being an anesthesiologist, our job is to make sure that the patient stay still and safe while they are under our care, so that you can perform colonoscopy without any undue interruption. Most commonly employed anesthesia is what is called IV sedation with monitored anesthesia care, where patients are gently put under anesthesia with various different types of medications. The one that is most commonly used is called propofol. They are being monitored throughout the whole process, looking at their EKG, blood pressure, and also oxygen saturation in the blood by a trained anesthesia professional. Is colon cancer preventable?
Absolutely, it is. We know that most colon cancers are caused by polyps, which can be removed before the polyp turns into cancer. And that's the whole point of having a colonoscopy done, is to remove these precancerous polyps, which approximately 25% of adults over 50 have.
You mentioned colon polyp. What is a polyp?
Polyp is basically a growth inside the colon, and they can start out fairly small, but if they are precancerous, then they can grow over time and turn into cancer.
So how frequently do you recommend colonoscopy for somebody without any family history or without any history?
Right now, the recommendations are that if somebody is 50 and over with no family history of colon cancer, healthy otherwise, no other contributing factors such as genetic factors that can predispose one to colon cancer, to get a colonoscopy at age 50, and then 10 years thereafter if colonoscopy is negative. In fact, most colon cancers occur in patients that have no family history. So it's important for patients to get screened.
Dr. Masrour made a very important point here. Most of the patients who develop colon cancer have no history of colon cancer in the past. Therefore, we strongly urge you to take this seriously and get your colonoscopy examination done. I have one more question for you. Are the screening ages different for different races?
It is. In African Americans, some experts recommend starting colonoscopy at 45.
African Americans to get the colonoscopy at an earlier age.
Right.
Can you explain how colonoscopy is done?
So colonoscopy entails basically a tube with a camera at the end of it, and it's advanced gently through the colon after being well lubricated, all the way to the end of the colon, which is a cecum, and then slowly withdrawn. The most important part of the colonoscopy is bowel prep, which patients have to go through, to make sure they cleanse the colon so we can have a good look at everything and to look for polyps.
I also get asked a question. I see the advertisement for ColoGuard. Is that a replacement for colonoscopy?
So COLOGUARD is something that can be considered as colon cancer screening. Although it's very effective in detecting cancer, it's not nearly as effective as a colonoscopy in detecting polyps. Therefore, we recommend that if the patient is healthy, that he or she can undergo a colonoscopy to proceed with a colonoscopy.
How long does it take?
A colonoscopy typically takes anywhere from 10 minutes all the way to 30, 40 minutes, depending on patient's anatomy and number of polyps and other pathologies that may involve the colon.
Can you educate us about colon prep? What does it mean and what does it contain?
Colon prep is basically like a laxatives that the patients take day before the procedure. And actually, we now recommend half dosing, that take one half of it night before the procedure, the other half 3 to 4 hours before the procedure. And this basically helps cleanse the colon. Of course, the patient also take a lot of fluids as well to help with the process.
Once when the colonoscopy is done, how long does it take to recuperate from this procedure?
There's really no recovery time. The patient usually feels fine after they are able to pass the air that we put into the colon. But I think you can address it better from an anesthesia standpoint as far as how the patients feel afterwards and how long it takes them to be able to go back to work.
From the anesthesia point of view, thank you for asking that question, Dr. Masrour. From the anesthesia point of view, we do recommend the patient to not drive or handle any machineries or make any major decisions for at least 24 hours. For a simple reason, some of the medications that we may have used to sedate will linger around. But we do not restrict them physically once when they are awake, alert, and oriented. And actually, we do follow a very strict criteria before we discharge them. We will discharge them only when they are stable and safe enough. And I have one more question.
Sure.
People with a family history of colon cancer, is the screening process any more frequent?
It is. So if a patient has family history of colon cancer, we recommend starting colonoscopy at age 40 or 10 years before the first degree family member was diagnosed with colon cancer. And furthermore, we recommend more frequent screening every 5 years as opposed to 10 years.
So with all those things considered, are there any risks with colonoscopy?
Sure, there are. Colonoscopy does have risks, just like any other procedure. Keep in mind that it's a very low-risk procedure, but risks include infection, bleeding, and very, very rarely perforations can occur, and in some cases, surgery would be needed. So
To address that.
To address it, yes.
You have taken care of a lot of our patients at our surgery center in North Texas Team Care. And we are very grateful for you for your time and effort in educating us. This is a very, very important and a very strong message what you're delivering. Colon cancer, as you mentioned, is preventable and it can be treated early on if it is diagnosed at an early stage. Often I get asked this question: I don't have insurance. Can I afford this procedure?
That's an excellent question. I get that question as well. The question that you really have to ask is, can you afford not to have it? Because it can really be a life-saving procedure.
And you really hit the nail on the head. And one of the impetus for us to start cash surgery program at North Texas Team Care Surgery Center is we had a patient who did not do her colon screening colonoscopies. She ended up neglecting her health and unfortunately was later on diagnosed with metastatic colon cancer, which ultimately, sadly, killed her. So it is very, very important that you take that seriously. Therefore, I strongly urge all of you to get colonoscopy done if you or talk to your physician if you need one. And you're welcome to reach us at North Texas Team Care Surgery Center at nttcsurgerycenter.com. This is Dr. Nagaraj Kikeri. Thank you.